If you are a man over the age of 50, or if you have a family history of prostate cancer, then listen up, because I'm going to share with you the #1 mistake men make when they're checking for prostate cancer. And this could be life-threatening, okay? So let's talk about it. Now, the most common symptom of prostate cancer is difficulty in urination. Okay? So when you go to urinate, you might find that the stream of your urine is a bit on the weak side. It's a slow stream, or you might find that you're dribbling after you urinate, or you're not able to completely empty your bladder. These are all classic symptoms of an enlarged prostate. And an enlarged prostate can lead to prostate cancer, so these symptoms should not be ignored. However, there are other causes for difficulty urinating besides an enlarged prostate. You could have an enlarged prostate and it could be caused by prostatitis, which is inflammation of the prostate. It could be caused by urinary tract infection, kidney stones, or it could be caused by something psychological like stress, anxiety, or depression. So just because you have difficulty urinating does not mean you have prostate cancer. But it is a symptom that needs to be investigated. So what is the #1 mistake that men make? Well, the #1 mistake is that they wait too long to get checked. They'll see their primary care doctor. The primary care doctor will do a digital rectal examination, which I don't think is very pleasant. And if he feels an enlarged prostate, he might check the PSA, which is the prostate-specific antigen. But many times these doctors are not trained in doing rectal exams properly, and even if they feel an enlarged prostate, they might not tell the patient that. Or, if the PSA is slightly elevated, they may not tell the patient that either. And so they kind of hide these findings from the patient, and the patient never knows. You know, it's estimated that 1 in 8 men will get prostate cancer in their lifetime. And the good news is that if it's caught early, it's very treatable. So the #1 thing is don't ignore the symptoms. If you have difficulty urinating, don't wait. Get it checked out. And also insist on a digital rectal examination. If the doctor doesn't offer it, make sure you ask for it. And if the PSA is high, don't let the doctor just brush it aside and say, "Oh, it's probably not a big deal." You need to get a biopsy if the PSA is high. And there are several different types of prostate cancer. There's the slow-growing and the fast-growing, and so you want to know what type of prostate cancer it is. So if you have a family history of prostate cancer, if you're African American, if you have a high PSA, if you have an abnormal digital rectal examination, you need to get a prostate biopsy. It's very important. Now, some people say, well, wait a minute, I heard that prostate cancer is curable. Well, it is curable if it's caught early. However, if it's not caught early and it spreads to the lymph nodes or to other organs like the bone, then it becomes a lot more difficult to cure. And so that's why we really want to catch it early and investigate these symptoms. Also, if you have a personal history of cancer or a family history of cancer, you should get on a healthy keto and/or carnivore diet. This will help you with all types of cancer, including prostate cancer. Now, I have a lot of information on my website about how to do a healthy keto and a carnivore diet. But here's the thing. Even if you're on a healthy keto and you eat tons of vegetables and you exercise and you're totally healthy, you still might get cancer. And one of the reasons for that is because our food supply is so toxic. I mean, we're eating food that has been sprayed with pesticides and herbicides. We're consuming GMO foods. We're consuming foods with glyphosate in it. And so even though you might be eating very healthily, you might still be exposed to some of these environmental toxins that can cause cancer. All right, the next point is, don't wait to see if it goes away. I had a patient years ago who had a lump in his prostate, and he just watched it for a year to see if it would go away because he didn't want to have surgery. Well, by the time he finally decided to get it checked out, it spread to his lymph nodes and he ended up dying within 2 years. So please, if you have a lump in your prostate, or you have these urinary symptoms, get it checked out. Don't wait. All right, thanks for watching. Hey, before you go, if you're benefiting from any of my content, I would love to hear about your success story. Please share it in the link down below.